The first and the most common type of asthma is atopic asthma. It's considered as a classic example of type 1 IgE mediated hypersensitivity reaction. It usually begins in childhood. A positive family history of atopy and asthma is common. The onset of asthmatic attacks usually preceded by allergic rhinitis, urticaria, or eczema. Attacks may be triggered by allergen in dust, pollens, animal dander, which is the material shed from the animal feather, food, and or infections. As we mentioned in the previous slides, the initial exposure to an antigen will result in excessive activation of type 2 helper cells that will start releasing cytokines, of which are interleukin 4 and interleukin 13, that starts stimulating the IgE production. Interleukin 5 activating the eosinophils. Interleukin 13 that stimulates the mucus production. Then IgE coats the submucosal mast cells. Upon re-exposure, the release of the mast cell drive mediators happen, and this will produce two waves of reaction. The first is the early immediate phase of reaction, and the second is the late phase of reaction. A skin test with a causing agent results in an immediate wheel and flow reaction. The skin prick test, for example, is the most common allergy skin test. So what we do? First, we get a series of tiny drops of the allergen on your back. Then you get a quick needle prick in the skin underneath each drop. If you are allergic, you will get red and itchy rash, especially at the needle prick site. Atopic asthma can be also diagnosed based on the serum radioallergosorbent tests, which is a blood test using radioimmunoassay to detect specific IgE antibodies and then to determine the substances a subject is allergic to. The second type is non-atopic asthma. Here the patient do not have evidence of allergen sensitization, so the skin test is negative. A positive family history of asthma is considered less common in this type. Respiratory infections due to viruses such as rhinovirus and parainfluenza virus and inhaled air pollutants such as the sulfur dioxide, ozone, nitrogen dioxide are common triggers. Although the connections between those exposures and the non-atopic asthma are not well understood, the ultimate humoral and cellular mediators of airway obstruction are the same to both atopic and non-atopic variants of asthma, so they are treated in a similar way. The third type is drug-induced asthma. Several drugs can provoke asthmatic attacks. However, aspirin is considered the most striking example. Patients with aspirin sensitivity present with recurrent rhinitis, nasal polyps, urticaria, and sometimes bronchospasm. The precise pathogenesis is unknown, but it's likely to involve some abnormality in prostaglandin metabolism from the inhibition of cyclooxygenase by aspirin. This type of asthma can be triggered by fumes, dusts, animal substance, chemicals, and gases. This happens after repeated exposures to the causing agent. Examples include farmers, animal handlers, manufacturers of foam mattresses, bakers, food processors, cotton workers, manufacturers of metals.